We're here today at Hawkesbury Dentistry talking to Dr. Steve Cross about his KaVo OP3D Pro, and we wanted to just touch on a few areas, Steve. What did you want a CBT in your practice for initially?
Well, we had evolved some years ago to having a need for CBCT. I'd procured an OPG system some years before, and we'd reached a stage where I felt that we needed to go to the 3D area of imaging and diagnostic work, and so I heavily researched the products and the suppliers of products.
Okay, so what were the two reasons you chose Australian Imaging and the KaVo OP3D Pro?
Well, with Australian Imaging, they were a specialist group of suppliers and maintainers of X-ray equipment, and I liked the fact that I could get first-class product knowledge and service, IT service and clinical knowledge from them.
Right, okay, so what has having CBCT in the practice meant for you?
It's just completely renaissance the way we do dentistry out here, as much as for more involved surgical procedures as for general practice dentistry. I use this machine every day for general practice dentistry, everything from MB2s, crack cusp, pre-prosthetic analysis, periodontal analysis. It's just never ends, the application I find for this machine.
And how have your patients received the technology?
Well, being 60 kilometres out from Sydney, to see this level of technology in a semi-rural practice has been an absolute gobsmacker for many people. And when they can see the diagnosis and understand and see our diagnosis, it's been accepted tremendously well.
Okay. And how has it changed the way you practice dentistry?
Well, the very first thing is a practicality. It's all in-house. We don't have to send people to Sydney or out of the area to get the CBCT. It's been a logistic improvement for our head nurse running the practice. X-rays aren't lost. On that side, it's been marvellous. On the diagnostic explanation area, I find it such a powerful tool. People can see and understand what you're telling them about, and equally you can see and diagnose and analyse with a far greater degree of accuracy.
And tips for dentists that are looking to purchase CBC technology, what would your thoughts be on that?
Well, I think when you reach the critical mass size of probably 1.5 dentists in a practice, you need specialist suppliers like Australian Imaging to really assist you in setting up, formulating a plan for having the machine placed in a certain spot in the practice where you want it. But the big thing I find, I repeat again, is the continuing backup. Make sure your supplier has that product knowledge, make sure that they have the IT knowledge and the clinical knowledge. And Australian Imaging are the only people that I found that was satisfactory. I'd looked at other suppliers many years ago, and we've never looked back since Australian Imaging came on board with us.
Wonderful. Thanks so much for giving us your vote of support, and we hope that you continue to enjoy your KaVo OP3D Pro.
Thanks very much, Sean.